The other really important thing for your people to know is genital urinary syndrome of menopause, or GSM. Again, it's good that they named it that because it used to be called vaginal atrophy. Nobody liked the atrophy term. Before vaginal atrophy, it was called senile vagina.
What?
Nobody liked that term.
That's a terrible term.
Welcome to the 1980s.
Vagina.
Senile vagina. I know, like I legit can't make this up. This stuff writes itself. The comedy writes itself.
Oh my God. Hello, my loves. We are back with an amazing guest this week. I'm very excited to talk about menopause and hormones. I feel like it's long overdue. I've been trying to find the right guest for this topic, and I think I found the perfect person. So Dr. Kelly Casperson is a urologic surgeon, author, sex educator, and top international podcaster whose mission is empowering women to live their best love lives. Kelly identified the need for better resources and developed a sex education membership that covers topics like sexual health, intimacy, mind work, and the science of desire. She combines education, humor, and candor in her podcast, You Are Not Broken, where she dismantles the myths people have learned and normalizes healthy, enjoyable sex worth desiring. For more information, follow Dr. Kelly on Instagram at Kelly Casperson MD or visit kellykaspersonmd.com. So welcome, Dr. Casperson. How are you?
So good. Thanks for having me.
Yeah, I'm excited. I really am excited to have you. You know, I'm 43. I have friends who are like starting to go into perimenopause or menopause. And it's one of those things where it's yet another one of those things, I should say, that just kind of baffles me. Like, how do I not know more? Like, you know, I'm in this age range. I have specialized training in sex therapy. And yet I still don't really feel even like prepared for this phase of life. And so I'm like, if I don't know enough, the average woman certainly doesn't know enough.
Yeah. When you think of think if you like put in your brain menopause, right?
Yeah.
And like what picture comes into your brain? For me, it's like a 70-year-old golden girl, you know, Betty White sort of thing. And you're like, no. We're talking 38, 42, certainly 48 is normal for menopause with the bell curve of average age of 51. So it's like, dude, if we don't get to the women who are younger, they're going to have gone through this alone and, you know, feel like they got hit by a Mack truck alone.
Right. And that's like exactly what I don't want for people either. And it just, I don't know. I just feel like we kind of have these, like we have the right to know how our body works.
Oh, totally. Dude,
our
body health education in this country / world is abysmal.
Like so bad.
And doctors, we always forget that, right? Because we're like, you kind of just think everybody's talking the same language, and it's ridiculous to think that. Like, women don't even know how many holes they have down there.
No.
Right?
No.
Right? Or that there's a clitoris, right?
Or where it is.
Or where it is. I just saw something like 62% of people can identify a clitoris on a drawing of a body. That's like all genders. It seems high to me. Yeah. Maybe that was like after a course.
Yeah. That was like aspirational. But yeah, I mean, we skip over all that when we're going through sex ed. If we even have sex ed, it's like our parents aren't talking to us. All the messaging, you know, I don't have to really tell you this, but it's like, yeah, it's like, where do people find this information? Podcasting, which thank God isn't censored.
Totally, because it's long format, so you can actually get into something and you're not censored. You can say things like clitoris.
Right. It's nice.
I have a friend who was like on a prominent talk show, and the legal team censored the clitoris on the drawing that she wanted to bring on. Yeah. And so we're like, yeah, it still happens. But, you know, I think with menopause, people think it just means no more periods.
Right.
And with that means no more babies.
Correct.
Right. So like, that's what people think menopause is.
And hot flashes. We know
and
about
hot
that.
flashes. And,
Those are the two things.
Yeah. And the, you know, the myth with that is if you didn't have a hot flash, then you didn't go through menopause. How many women do I see who are like, I didn't go through that? And I'm like, no, what you mean is you didn't have a hot flash.
Right.
Right. So about 60 to 80% of people, 80% of people will have some sort of hot flash, but that a hot flash is experienced in different ways by different people. It's not like a universal thing. Night sweats are basically hot flashes while you're sleeping.
Okay.
But so many people think that nothing happened if they didn't experience the hot flash. And I would also argue that the loss of periods, the loss of pregnancy is a consequence of what happens, but that's not what it is, right? So what it
let's
is,
define it. Yeah, let's start there.
Define it. So the technical definition of menopause is 1 day. So you have menopause for 1 day, and it's actually a retrospective day because it's 1 day after you haven't had a natural period for a full year.
Okay.
Right. So like you don't really even know it's that day until like right. So that's menopause, the day. And then you're post-menopause. And before that, you're pre-menopause, or what they call perimenopause, which peri means around.
Got it.
So around, some people will define perimenopause as up to a year after the year after no periods. So like it gets very definitional, but when people when we talk about the menopause transition, right, that kind of means like the years leading up to, and then the early couple of years with no periods. It's a crappy definition because how many women have had hysterectomies or IUDs or on birth control, right? So they don't have that marker of like, I have a uterus that has stopped bleeding.
Right.
Yep.
Okay. So
but why does it happen?
Okay, can we define perimenopause too, though? Because now I'm like, wait, you're saying perimenopause could be after?
Depending upon what definition you want.
Okay.
I don't care. But yeah, so perimenopause can mean the years surrounding menopause. And some people will extend that to be like a year after what the menopause date is. So there's kind of this bubble around that 1 day is perimenopause. Other people will describe perimenopause as up to 10 years before menopause, which how do you know you're in perimenopause? This is a clinical diagnosis. There's no test. You know, I had one woman, she was like obsessed of like, but am I in perimenopause? And I'm like, well, you're 44 by definition. You're within 10 years of average age of menopause, which is 51. Yeah. But she was like, but am I? And she was trying to hound on if she was in perimenopause. And I'm like, what are you actually asking? And what she was actually asking was, is it okay for me to take hormones?
Oh,
right.
Wow.
Yeah.
People are
so it's
fascinating.
Always pro tip to the doctors if somebody like get into actually what they're wanting to know. But and I was like, of course you can take hormones. You absolutely can take hormones in perimenopause. And perimenopause is really, an easy way to describe it is reverse puberty. So puberty is this like on, off, irregular periods. Maybe they're super light, basically trying to get you on to this like smooth cyclical, not that everybody's life is smooth cyclical periods, but like kind of getting you onto the on-ramp of the highway of reproductive period in life. And then perimenopause is the off-ramp of kind of being done with the reproductive period of your life. So heavy periods, 25% of women, heavy periods, some people light periods, the periods start to space out. You might start to skip a period. And again, it's because of the ovarian hormones that are decreasing. This isn't exactly like, oh, my periods are crazy. It's like, that's a result of the ovaries they're basically sputtering out. We are outliving our ovaries.
Yeah. Oh, that's interesting.
But the good news is, the good or bad news, the good news is we're outliving everything, right?
Yeah.
We outlive our hip, you get a new hip. You outlive your teeth, you get new teeth. You outlive your eyes, you get glasses.
Right.
You outlive your hearing, you get hearing aids. And I really want to normalize this of like, the exceptional thing is our lifespan. It's not that like ovaries are for some reason, ovaries aren't made to live to 100, but we are now. Like Western medicine's amazing. We can prevent, dying from trauma and infections, which was the major killer of people before 100 years ago. So really, in thinking of perimenopause and menopause is like, we are lucky to get the opportunity to keep living. That doesn't mean we should suffer.
Yeah. So I think part of what I'm curious about with the perimenopause is like, when should we be aware of symptoms, and do we need to when should we do something about it?
Yeah. So like if you look up symptoms of perimenopause, like it can be like 100 different things, not to stress people out, but to emphasize we're all going to feel this in different ways. Some of us aren't going to feel anything. We're just going to be humming along and then no more periods.
Yeah, I'm hoping for that.
Right. Right. I mean, so the healthier your system is, and what do I mean by that? People who exercise frequently, people who have healthy diets, people who have their glucose under control, people who don't smoke, do tend to have a smoother time with the hormonal changes. Doesn't mean you're going to sail through it, but really healthy habits have been proven to take the edge off of things.
Okay, so that's good to know that there's, things that are within our control in terms of managing blood sugar, exercising, diet, that kind of thing. Yeah, I think part of what I'm curious about is like, if you do start having symptoms, is it good to go on hormones? I've heard you talk about this a little bit, so I somewhat know your answer, but I would love for, some of our listeners to understand, like, what are the impacts of hormones, and is this a healthy thing? I've also listened to some like Dave Asprey, and he talks about like the Wiley protocol. And I know sometimes people try to just stay in sort of the youthful, fertile period. So what's actually healthy for us?
First of all, I would say some people who make claim or look like experts are not.
Very true.
And that's all I'll say about your previous comment.
Okay.
I'll remain professional.
That was very professional.
So for the first thing to know is that the hormones that are commercially available, FDA approved and covered by your insurance, which means low cost for most people, are the hormones that your body makes. So we're just your thyroid's low, we give you thyroid. Your pancreas doesn't produce insulin, we give you insulin. These are hormones that your body naturally makes, and we just give them back. So as far as people, when trying to reach all people, some people have big stigmas around what a drug is or the fact that I don't take drugs. Keep in mind, these people take 30 different unregulated supplements, but their perspective is somehow a prescription means something different than something bought at CVS or Target, right? Yeah. But I would say that these medications are highly regulated, very safe, and are basically just what your body makes, and we're just giving it back as your body starts declining its own production. Okay. And I really hope that helps people's minds open up to like, these are, there are lots of different drugs that can be helpful and that have side effects. Hormones are legitimately just what your body makes, and we're just giving it back to you, usually in smaller amounts than what your body naturally makes. Okay. So I always want to introduce that because I know listeners come from all different, belief systems. Absolutely. About, what they do or do not want to put in their body. I just want to give people different ways to think about it.
Yeah, that makes sense.
But I would say when your symptoms are affecting your quality of life, I'm a lot more anxious about getting on airplanes now. I'm a lot more short with my kids and my partner. Okay. I cannot get more than 5 hours of sleep. Damn. I'm waking up drenched. I had one woman, she's like, I don't have many symptoms, but I have 18 different nightgowns because I have to change my nightgown at least 2 or 3 times a night because I soak them. It's like, wow, people will downplay what's actually going on in their life unless you give them space to open up about it.
Yeah, I absolutely see that. It's like, unless we get very kind of granular, sometimes people are like, oh, it's fine. But I think when people are so used to it, they're just like, this is just my normal, and so they don't always think to report it. So, yeah.
Yeah. I mean, especially coupled with the lack of medical education about their own bodies of like, oh no, 100%. These are all mood changes. Like the rate of anxiety disorders, depression disorders skyrocket in midlife. 25% of midlife women are on an SSRI, and all the experts would argue giving you your hormones back naturally is first line treatment, and SSRI would be second line treatment for mood changes associated with perimenopause. And I always do my asterisk caveat: severe depression needs to be treated, but if you're noticing like some moodiness, some anxiety, I would try the natural hormones first.
Yes.
If you can, if given that 100%.
Option.
And then the SSRIs can be our backup plan.
Yeah, I think
some people need both, but many people are like, I got back on the hormones, I'm smooth, I'm good.
Yeah, right. And I think that's an important point for mental health, is like, people don't necessarily realize what a big impact their hormones can have on mental health, like
hormones are life.
And actually, now that I'm thinking about it, this woman was probably in the menopausal age range, but she came in and she's like, I have so much anxiety and I have to address this. And we found out she had a thyroid issue.
Yeah.
And like the second she got on thyroid hormone, it like all resolved itself.
Yeah.
You know? And it's like, yeah, we have to look at these biological aspects. Like it's a mind-body system. It's, you know, not separate. So yes, look at your hormones. And yeah, so one of the other things I wanted to ask about is this phrase like bioidentical hormones. So you hear things like that. Like, is it not all hormones are created equal? Is there something people should be looking for?
Yeah. So let's understand where that came from.
Mm-hmm.
So the Women's Health Initiative came out in 2002, basically scared the crap out of everybody. 70% of women were taken off their hormones in this country. Hormones are bad. Hormones cause cancer. Hormones cause strokes.
Yes.
Like it made national news on a very large scale.
Uh-huh.
So women are suffering. What are they to do? Who's going to help them? And a group of helpers said, it's okay. These are bioidentical. These are safer.
Oh, interesting.
Right. Now, fast forward to now, like I previously said, the medications you get that are FDA approved and covered by your insurance now are bioidentical.
Okay.
The UK doesn't even use the term bioidentical because it's a marketing term and it confuses people.
Okay.
Right. So they use body identical, which helps you understand these are just the hormones that your body makes and we're giving them back to you.
Okay.
And the point is, if you go to somebody who sells bioidentical and jacks up the price 10 times, they're marketing to you because bioidentical feels safer until you realize, all the hormones, all the standard hormones for perimenopause and menopause treatment now are bioidentical.
Okay. So
now caveat, birth control is not bioidentical.
Oh.
It can't be. It needs to trick your body into thinking you're pregnant. That's how it works. Right.
Okay.
So it's a very important education for people, and education is power. It's like
absolutely.
But when you go in needing birth control, we don't say this isn't natural. We don't say that. We say we're going to help your body not get pregnant until you're ready to get pregnant.
Right.
Right. So like the judgment that people throw on medications and hormones is absolutely insane sometimes, and I think it comes from lack of knowledge, lack of education.
That makes sense. And I think the way you're describing that, like, hey, these are all the hormones your body produces, like, for sure that reduces anxiety for me. It's like, okay, well, that, my body will probably receive it well. And I think that's also important too, because we know the placebo effect is a thing. And so if people's mental state when they start something is like, okay, cool, this will work great, then it's probably going to have a higher likelihood of working great.
And that's an important point. If you did not tolerate oral birth control pills for whatever reason, that does not mean you're not going to tolerate perimenopause, menopause hormone therapy. They're incredibly different molecules.
Yeah.
Estrogen doesn't equal estrogen when you kind of throw that term around.
Okay.
Right. So many people are like, I can't take hormones because birth control X, Y, and Z'd me. It's like, this is different, completely different product.
Okay.
Right. And the more people are educated about that, they understand like, okay, well, and it's a much lower dose.
Okay. That makes sense. And I think the fact that you can like explain it in a way that people understand is so helpful, because I also think there's a lot of, mistrust of big pharma, and it's like, they just want to make money off of us. And it's like, and there's also good products out there. There's also things that will change your life in a good way.
The same could be said for the supplement industry.
Oh, for sure.
You are a sitting duck, my friend. Menopause is undertreated and you're looking for solutions.
Yeah.
You know how many people want your money? Right.
A lot.
And so
yeah.
I think, the supplement industry, I think it sees a large opportunity.
Right.
And supplements don't mean safe. Supplements don't mean effective.
Right.
Like that is way more the Wild West
than
something that's been through rigorous packaging, testing, sterilization, purity testing of an FDA approved medication.
Right. And I think there's good and bad in both categories. And I also think it depends on the person and their body, it's like everyone's going to respond different, but for sure what you're saying, I am someone who probably was taking 35 supplements at one point, and, definitely realized just because it's a supplement doesn't mean it won't have side effects. Some of it.
Oh yeah.
Really...
There's liver failure.
Oh, wow.
Documented in some menopause supplements.
Oh,
like by definition, you don't know what's in that pill.
Right. Right. And that's
the supplement industry.
Right. And so, yeah, I've done, a good amount of research to figure out like what's legit, but it's like, yeah, you're on your own doing that. Like there's no regulating body. So that is a good point. And I appreciate that. And I often found that with functional doctors who I love what functional medicine is all about, but it would sometimes just be like, you're still giving me pills. You know what I mean? It's like, they're just different pills, but it's like, we're still kind of defaulting to that. So, yeah, so that was an interesting experience to go through. But yeah, so what can people expect? Like what are some of the challenges of perimenopause and menopause? And, in terms of even, I'm thinking like, how the tissues in your body changes, how this impacts your sex life. So what do you see with that?
Yeah. So I really got into menopause because of sex, because I, became pretty knowledgeable in female sexual health, sexual dysfunction. And people are like, yeah, but you know what happens. Yeah, but you know what happens. And I'm like, I'm looking down the barrel of this, I'm of the age.
Yeah.
What happens? So I deep dove in the two main reasons that women become not sexually active in the perimenopause menopause transition is two things. Number one, availability of partner. Number two, vasomotor symptoms of menopause.
Okay.
I always say I can't help you with the first one. So
yeah, I'll try to help with that one.
yeah, you help with the availability of the partner. Yeah. But certainly if you're not in the sexual context, if somebody's, you're kind of like, well, whatever. Not everybody, but so vasomotor symptoms of menopause happens in perimenopause. You're allowed to have hot flashes and periods. A big myth. If your doctor or provider tells you that you can't start on hormones until your periods end, that's bullshit. Tell them to show me the rule. There is no rule.
Okay.
And why would that make sense? Why does the woman who gets a hysterectomy get to be on hormones, or the woman who has an IUD get to be on hormones? Like, right? We've fakely removed her period.
Right.
And then the natural woman has to wait for her periods to end. That's completely made up.
Yeah.
It makes no sense.
Yeah.
Right. So you can have vasomotor symptoms of menopause in perimenopause. Some would argue they are worse in perimenopause because of the extreme fluctuations of hormones in perimenopause. So if you're not sleeping, if you're anxious, if your joint aches and pains, the musculoskeletal symptoms, people have no idea, frozen shoulder.
Really?
It happens at age 51. Yes.
Oh, wow.
And estrogen, they're studying estrogen as a protective mechanism to say, what if you just start hormones a little earlier? Can you prevent frozen shoulder? Right. So if all those things are happening, you are not feeling desirous. You're not feeling relaxed. You're not feeling receptive. You're not feeling sexy. You're exhausted.
Yeah.
Your body is going through some things. So really treating menopausal symptoms can improve your sex life. Shocker. You're sleeping better. You can have sex better. Right.
Yeah.
So those are the two things. And then the other really important thing for your people to know is genital urinary syndrome of menopause, or GSM. Again, it's good that they named it that because it used to be called vaginal atrophy. Nobody liked the atrophy term. Before vaginal atrophy, it was called senile vagina.
What?
Nobody liked that term.
That's a terrible term.
Welcome to the 1980s.
Vagina.
Senile vagina. I know, I legit can't make this up. This stuff writes itself. The comedy writes itself.
Oh my God. That one's special. Okay.
Yeah. So we're getting better at calling it what it is.
Yeah.
But it certainly can happen in perimenopause.
Okay.
The thing people don't know is it gets worse and worse the longer you go without estrogen.
Oh.
So estrogen is everywhere in your body. It's in your brain. It's in your ears. It's in your joints. It's in your clitoris. It's in your bladder.
Yeah.
It's in your heart. Estrogen's everywhere.
Okay.
So to call these things sex hormones is really unfortunate.
It is.
Because it really it's a sex hormone. It's extra. Right?
Right.
These are brain hormones.
Wow.
These are cardiovascular hormones.
I do feel
these are
so
incredibly
misled.
Important. You have been misled, my friend.
Okay.
Don't get me started on testosterone.
So listeners, if you're feeling this way, I am also feeling this way. You're not alone.
Yeah, you're not alone.
Okay.
Testosterone's been erased from 50% of the bodies, right? I asked Google what testosterone is, and it says it's the male sex hormone.
Oh my God.
Which is, yes, and.
Right.
It's in all bodies, and it's not just for sex.
And regardless of gender, it could impact your sex drive,
Oh yeah. So the pelvis becomes a female pelvis because of the hormones that are present.
Okay.
Right? And then you take the hormones away and you get atrophy, burning when you pee, urinary frequency, getting up at night to pee, dry, painful vagina, decreased lubrication. And it gets worse with time. So people don't know that, again, remember, menopause is a hot flash. And if you didn't have a hot flash, you didn't have menopause, which again, not true, but that's what a lot of people think. So people will come to see me like 7 years after their periods. They haven't had sex in 5 years, and they don't know that that's because of low hormones.
So yeah, so let's say people are experiencing GSM, as we're calling it, which used to be called vaginal atrophy. What are some of the symptoms of that, and how do you help people with that stuff?
Yeah, so some of the symptoms, and remember, this can happen in perimenopause. It can happen years after menopause, and a lot of people don't correlate it with a drop in hormones, and that's really what it is. It's a drop in estrogen and testosterone that can cause issues in the pelvis. Urinary urgency, frequency, burning. So many women, recurrent urinary tract infections. They just keep taking antibiotics and not getting better. Getting up at night to urinate, decreased sensation sexually, decreased ability to orgasm, painful penetration, especially at that 6 o'clock entrance, that bottom part of the entrance of the vulva vagina. It gets thinned, it gets tight. You lose your elasticity. Estrogen is important for collagen and for elasticity and moisture. Right. So you can use
that all makes sense.
Everybody should use lube with sex, whether you're 21 or 70. Like lube just makes everything better.
Great idea.
It's just a great idea. Pro tip. Get a tube of lube. I really like silicone lube for drier vulvas because it doesn't get absorbed like a water base does. Will last a lot longer. So I have a silicone bias with dry skin. And then this is a $20 solution, my friends. This is a tube of vaginal estrogen cream. And yes,
we like $20 solutions.
We love $20 solutions. If your insurance does not give you a $20 solution, I'm going to give you 3 pro tips to remember. So I went through this too. I've got Blue Cross Blue Shield, went into my pharmacy. They said that'll be $260. I said, do you know who I am and how much vaginal estrogen I put through this place? And I pulled up my Good RX app. I know. Good RX. You type in the tube of cream, you type in your zip code. That should be about $20. Mark Cuban, Cost Plus Drugs, is an amazing mail order pharmacy. Vaginal estrogen's right around $20, $25. So you just have your prescriber prescribe on Epic, all the main things you can prescribe to Mark Cuban, Cost Plus Drugs. So that's going to be less than $30. And then Amazon Pharmacy is kicking some butt. And doing, again, this is cash. It's a crime that we all have health insurance and you have to pay cash to get the lower price. This is not okay. I do not consent to this.
That should not be okay.
This is not okay. But this is the world in 2024 until you complain more to your insurance companies and say, why am I not getting the lowest price by having insurance? Why is paying cash the lowest price? This is a crime. But yes, it is a $20 solution.
Yeah.
This is generic. It's been around since the 60s and 70s. It's over the counter in multiple countries. That's how safe this is. Now, the problem with a vaginal estrogen product, and you can get it in a ring, in a tab, and in a cream. I love the cream because you get it at the 6 o'clock spot. You put it on your labia, so your labia don't go away. People don't know your labia minora resorb and go away after menopause. You get it on your clitoris. Keep your clitoris healthy. So I have a cream. A lot of people, not everybody, but a lot of people.
Even if you're doing the vaginal estrogen or
no? Not if you're doing the vaginal estrogen. Hormones keep labias.
That'll prevent it.
That's going to be my next t-shirt. Hormones keep labias.
Wait, what did you say?
Hormones keep labias.
Catchy. Very catchy, Kelly.
Very catchy. Thank you. I'm going to write that one down. That is a good, at least that's a good
I'll
meme.
wear one for you. That's
right?
pretty,
Thank you.
That's pretty funny.
Hormones keep labias. I love it.
But no, it's like these are things people don't talk about. People don't talk about the specifics that like your labia minora, which is the smaller lips of your vulva, and for people who maybe are not sure what we're talking about, can just be reabsorbed. And then you only have the labia majora, the bigger outer lips.
Yeah. And so people would say, what? Well, the what is that labia minora has at least 2 roles. Number 1, sexual arousal, right? Great nerve endings, great for sexual arousal. Number two, it protects the urethra. It protects the inside of the vagina. It acts as curtains. And you don't want them to go away. The urethra will become more pronounced with low hormones, and making it more susceptible to being irritated, burning with pee, recurrent urinary tract infections, right? So we want to protect our tender, sensitive structures, keep them healthy.
So basically what I'm hearing, and I've seen you say this on social, is like, get on the hormones early. Like, don't wait for things to get bad.
I mean, that's what anybody who is an expert in GSM is like, why would you wait for this to happen? And odds are, like flip of a coin, GSM happens 50 to 80% of vulva owners. So like,
that's pretty.
It's not chance. Like why are you trying to prevent something that happens 5% of the time? Of like, I will be darned if I start suffering before I start preventing the suffering. It just makes sense to me. Like, why should I wait to get out of shape to decide to get into shape? Right? Like,
that's
there are some things that they're just something. Yeah, right. Like, why wait for heart disease to start eating vegetables? Right? Just like start eating vegetables.
Just take care of your body.
Just take care of your body. Yeah. So, and because it's local hormones, you either call them local or pelvic or vaginal. We don't call them vaginal on social media because they block anatomically correct words on social media. So a lot of times I call it pelvic hormones.
There you go. I know,
it's so upsetting. That's not going into your body. It's too low dose. It's like sunscreen, right? So it will not help you sleep. It will not help your moods. It will not protect your bones. It will not help hot flashes. That is local hormones only for GSM. Very safe. The problem, there are multiple problems, including cost, but one of the problems is the warning on the local hormones is the same warning as very high dose oral synthetic non-bioidentical. So the FDA doesn't care. It's estrogen, it's estrogen, it's estrogen. They're going to put the same warning on everything. So literally the warning says it's going to kill you. It says probable dementia. Probable, not possible.
Wow.
It's all wrong. Breast cancer risk, wrong. Heart disease, stroke risk, wrong.
Is crazy.
Can't use if you've had a blood clot, wrong. It is all wrong. We're working on changing it. But if your provider doesn't tell you those warning labels are wrong, you're going to read it and be like, they're trying to kill me. I'm not going to use this.
That's really wild to know, though, about the hormones having kind of misleading labels. And, I'm curious, like, is there anyone where it is contraindicated? I had a breast cancer survivor as a client, and
not contraindicated.
She was on all these kind of like hormone. Really?
There's nobody that can't take vaginal estrogen. Wow. When we have guidelines, you can go online, you can search the ACOG, American College of Obstetrics and Gynecology. There's online statements saying this is safe for breast cancer survivors. Why? Because we don't absorb it. It's not going in your body. This is skincare.
But
it gets into your vagina, which
telling
helps
her not to do this.
Doctors don't know. People are only about 5% of breast cancer survivors are on vaginal estrogen. It is not. They do not know they can be on. And again, doctors think estrogen equals estrogen equals estrogen, and it's not true.
Okay.
And they're suffering, and they're getting.
Which kind of doctors do actually know? Like if people listening are kind of like, what type of provider do I look for, and how do I make sure I find someone who knows what Kelly Casperson's talking about? Yeah.
This would be my advice. It doesn't matter so much what they know, is that they care.
Oh, that's cute.
Oh, thank you. I know, it's cute. Because you can go in and you can bring them the guidelines. And this is the other pro tip for seeing a doctor and asking hormones. Can I just try this for 3 months? Let's just try it for 3 months, and I will schedule a follow-up, and I will tell you how it's going. That is the power move way to talk to doctors to try something.
Okay.
Because the doctor knows you're reliable.
Experiment.
You're going to come back.
Yep.
If it doesn't work, we'll stop or we'll change doses. Right. Like that is the power move. And if they don't want to give it to you, you can ask, and you always do this in a nice way, but you can ask, why can't I try this? And if they say, because estrogen causes breast cancer, you can then say, the current studies say that it doesn't. can you show me, what you're referring to? Because a lot of doctors sadly have not gotten the memo that the WHI is flawed. But yeah, you can ask nicely.
The
and just
WHI,
Women's Health
that's
Initiative.
the 2002 thing?
That's the 2002 car wreck for women's hormones.
Okay. This is so helpful just to like get this information from someone who's like in it all day, every day with people and really helping people with their bodies. Yeah. I'm kind of, I'm just like blown away still. One other question would be, thinking for myself, but also my listeners, is like, how will I know it's time to like go get the hormones?
Yeah. So for most people, symptoms will drive them in, right? They'll be like, I can't live like this anymore. I need some solution. So that's kind of the clear cut case, right?
Okay.
The not clear cut is I'm going to make something up. I'm 48. I feel fine.
Yeah. Yeah.
Or let's say I'm 52. So let's say I'm a year past average age of menopause and I feel fine. Okay. Let's talk about, because this is the interest. This is the future. I truly think this is the future.
Okay.
I've had no symptoms. Like once a woman is educated on what's happening to her body, I guarantee you she will notice something. But let's say she hasn't noticed. Let's say she hasn't noticed her body, her lean body mass going down and her fat deposits going. Let's say she's noticed nothing, right?
Okay.
You can't see osteoporosis. You can't see heart disease. You can't see brain changes. You can't see insulin sensitivity changing. All of these things change when your estrogen goes down. And you can't see it. So there's a role for saying, hey, can you check my insulin sensitivity? Can you check, can I get a bone scan, see what my lean body mass is, see if I've, have osteopenia. So you can check to try to check for the things that you can't see. Or I think you should be allowed to say, I'd like to be put on this low dose hormones to help prevent these things. I think a woman should be able to make that choice.
That makes sense. Like when it's kind of imminent and it sounds like, if it's coming your way anyways and it's a low dose, and I would think by the time you're 48, 52, your estrogen has at least started declining.
Oh yeah, absolutely. For the majority of people. Some people are late menopause. Some people will have periods till they're 58. Oh wow. And this is what we know about estrogen. Estrogen is good, not perfect. We all age. Estrogen does not prevent you from aging, right? This is not a miracle. This is just a hormone. So estrogen is good at preventing disease. Estrogen is not good at treating disease. Once you have heart disease, once you have memory loss, once you have, significant osteoporosis and fractures, it cannot reverse those things. And some would argue it actually might be unsafe to give you estrogen once you have those things going on. So you have a critical window of, I feel fine, but I want to lower my risk of disease.
Okay.
That is the conversation.
I like what you said about checking the glucose, checking the bone density, like look for those things.
Yeah, you can look, because you can't feel that. You certainly can't feel that. But we're not there yet. As a nation, we're not going to, and the guidelines say, we're not going to throw the nation on estrogen, like to prevent disease. There's no medication that is indicated for primary prevention of any disease in women. Not baby aspirin, not statins, not a blood pressure pill. There is nothing as a nation that we do to prevent disease. But as an individual who's healthy and cares about, I need to get to 95 because I got to see how this world turns out, and I want to be as functional as I can. I think if she wants to accept, the risks and benefits of hormones, she should be able to take them.
So this is really honestly amazing, like knowledge bombs that you are dropping on all of us today, Kelly. And like, if people are just like, I need to get more of Kelly. She's amazing. She's so smart. Where can they find you?
My podcast is called You Are Not Broken. I talk a lot about sex and hormones on that podcast. So please come over and find me.
Amazing podcast. Yes.
The book is for pre-order on Amazon right now, coming out in September. Called You Are Not Broken. Stop shoulding all over your sex life.
Yes. Love this.
So fun. I have a menopause chapter in there.
Oh, cool. But yeah, everyone go buy the book because it also really helps creators when you buy during pre-order time. So go do that. I will go buy one as well.
Yes. Thank you. And then Instagram. The Instagram's blowing up. So go hang out on Instagram. Kelly Casperson, MD.
And that's how I found you. You create amazing content. And I think you're just very, real and like tell it like it is. And people need that. So thank you.
Thank you. Thanks for having me.
Absolutely. This was awesome. Thanks everybody for listening. And we will catch you next Monday. Bye.
Bye.